everyone, it's Kirsten here. Welcome to another episode of Weekly Hope. It's actually our second this week, so we are super glad to be here, coming to you live from Facebook second time yesterday. We had a great conversation with Dr. Nicole Garber from the Meadows Ranch, and she was on talking to us about the reality of life in recovery. And today we've got Sam Hicks here from Timberline Knolls Residential Treatment Center, and we're going to be talking today about everything you need to know in regard to treatment for addiction. And this is a super important topic, obviously, because so many people struggle with addiction, but also in the context of eating disorders, these things often co-occur together, so often, along with other mood and personality disorders, trauma. So all of these things often coexist, and it's really important to expand our horizons and just find out more about these things. As well, if you're someone who is struggling with an eating disorder and also has had an addiction, or that's a part of your struggle, this session is also really for you. Or of course, if you're a family member or a friend or a loved one who's trying to support someone or help them to get the care that they need, of course, hopefully this will be really helpful and encouraging for you. So before I welcome our guest and bring her on screen, just as I always do, before we dive into our topic, just give you a little bit of a glimpse of what we do here and why we're here. Weekly Hope is a weekly show. We're a part of Eating Disorder Hope. Obviously, you're here on our Facebook page. And we bring on guests, and I interview them every single week on a wide variety of different topics. And we've got experts, clinicians, authors, advocates, nonprofit leaders, just a wide range of people to talk about different things. And so we're always looking for good topics. So if you've got an idea, I would be happy for you to share it with us. So go ahead and do that. You can put it here in the comments. You can message us across any of our social media on Facebook, Instagram, and Twitter, but let us know. And of course, just want to encourage you throughout the show that the reason we do this on Facebook Live is so we can hear from you. So as I always say, hey, let us know where you're signing in from. Tell us your name, where you're from. And at any time, feel free to jump in and ask your questions, because we've got about 20 to 30 minutes with our guest here, and it's really valuable time. So just want to encourage you that if you've got a question, don't hesitate to ask. We always get those questions in, and they often lead to a really incredible discussion. So that's all I've got to say. I'm going to bring on our guest. Here she is on the other side of the screen. There's Sam Hicks. She's joining us from Lamont, Illinois at TK. Welcome, Sam.
Thank you. Thank you for having me.
Yeah, of course. So before I start asking you questions, I'm going to tell people a little bit about your background. So I'm going to read a little bit of your bio. So Samantha, going by Sam, is the Director of Individual and Family Therapy at Timberline Knolls. She oversees the therapist staff and works with management to focus on issues related to compliance, program development, and interdepartmental collaboration. Sam began her work in the behavioral health field in 2014 as a counselor. From there, she worked at Heritage Counseling Center, Pillars Community Health, and Timberline Knolls, of course, as a continuing care counselor, therapist, and clinical lead. She got her associate's degree from the College of DuPage and her bachelor's in psychology from the University of Illinois at Chicago. She went on to earn a master's in counseling psychology from the Chicago School of Professional Psychology. And beyond that, she is a real expert and very passionate about the topic of addiction, and is in the thick of it every single day. So that's a little bit about Sam. Sam, thank you.
Thank you for having me.
So first of all, I read a little bit about your bio, but tell us about what you do at TK.
So I oversee all of the individual and family therapists of our residential program. So I get to help all of the therapists kind of collaborate on what is the best treatment for our residents, any places that they get stuck, how to look at the case a little bit differently. And I also carry a caseload occasionally as needed.
Gotcha. And so at Timberline Knolls, obviously you're a treatment program not only for women with eating disorders, but also with women with co-occurring disorders, addiction, underlying trauma, all of these things. If people haven't heard the term co-occurring before, can you explain what that is and how important it is that these things are all treated together?
Yeah, absolutely. So co-occurring means that you have more than one diagnosis at a time, and one may not be more prominent than the other. So we get a lot of co-occurring struggles here, whether it's mood, eating disorder, and addiction. And so at Timberline Knolls, what makes us unique is that you don't have to pick one of those areas to focus in on and kind of neglect the other ones. We focus on you as a whole person altogether. So you can be in addiction groups and eating disorder groups while also working on any mood related struggles.
Yeah, so good. And how common is it that addiction particularly is co-occurring with eating disorders? How often would you say?
It's fairly common. I don't have an exact statistic, but we definitely see a lot of women who may struggle with an eating disorder and also have that substance use component, whether it's using alcohol so they're not eating so much or other substances that may suppress eating. All of it kind of works together to create what is going on to cover up and cope with the struggles.
Yeah. It's interesting because when I was struggling with my eating disorder and in recovery, what was fascinating was prior to that, I had never understood how people got addicted to things. Mm-hmm. And I never understood why people would choose to do that. I was very judgmental. That was probably my anorexic brain. But through the recovery process, I realized I could empathize with people who struggled with addiction because I'm like, oh my gosh, now I get it because I feel addicted to restricting, or there's certain things that I feel like this is out of my control. And yet, obviously, an eating disorder is not an addiction. Or is it? And I'm not saying that it is, but I want to get your clinical perspective because there's a lot of controversy, especially as it relates to food addiction. That term is thrown around a lot. Is binge eating disorder or food addiction, are those the same thing? Is food addiction real? How much can we use the word addiction with eating disorders?
Mm-hmm. I definitely think they're all related, whether it's a food addiction or a struggle. Either way, we're looking at something that we're struggling to cope with something. And so we're using these mechanisms, whether it's a substance or restricting or food, that's all helping suppress whatever we're feeling in that moment. So our brain runs on the pleasure principle, and whether it's restricting or purging or a substance, it's all feeding that pleasure side of our brain, making us want to continue doing it. So I definitely think food can be an addiction, just like caffeine is an addiction, just like alcohol can be an addiction, where if it's used in that maladaptive way to cope with something and you're using it in a way that you can't stop, then it's probably a struggle for you.
So it's really about emotional regulation, and it's something that manifests itself in so many different ways. That could manifest itself in drugs or alcohol or process addictions, which actually I should have you tell us about those, or disordered eating behaviors. But really the underpinning of it all is emotional regulation, right?
Mm-hmm. Yeah, absolutely. It's finding our brain works in a way to try and help us feel better the fastest way possible. And if we don't have a lot of those coping skills, or we've learned that this way makes me feel better faster, then our brain is going to continue to do that. So we continue to feel better.
Our brains are highly efficient.
Yes.
And we'll get to the hope of this at the end, because I had a therapist once give me a really, really great analogy or like word picture to try to how to change that brain wiring. But before we get to that, I did mention process addictions, and we didn't talk about it before this interview, but can you tell us what process addictions are? Because that's also another clinical term that's used a lot, but most people out there might not know what it is.
Yeah, so a process addiction, instead of like a substance that you're using, you're engaging in some sort of behavior. So gambling is a process addiction, shopping, video games, a lot of ways to distract our brain from what we don't want to focus on, or the unpleasant aspects of it. So I think process addictions are getting a lot more focused lately, but have definitely been around for a while. Like there is Gambling Anonymous and those kinds of things to try and help people who struggle with that process-oriented addiction.
Yeah. This is another question that just popped into my mind. What is your clinical perspective on smartphone addiction? I mean, that term is being thrown around a lot, and technology, social media addiction. Are these real things? Or, I hear skeptics say like, oh, everything is an addiction now.
I think in used in extremes, I think there definitely could be a smartphone addiction or social media addiction if you're using it to avoid something else or trying to get that instant gratification by how many likes you got in your Instagram post and those kinds of things. I think we're using that a lot to connect with people instead of actually having a face-to-face conversation about what might be going on.
Yeah. So how is the treatment process, obviously you're doing this every single day, different for those in recovery from an eating disorder versus those in recovery from addiction?
So with substance use, part of how it's different than eating is really finding a new relationship with the food, because we can't avoid the food because that's sometimes part of the problem. So where substance use, you are completely usually eliminating that from your life, whether it's alcohol, cocaine, whatever your substance of choice might be. And it's finding a lot of times new social circles, new everything to not have you in those triggering environments that make you want to use substances. So a lot of the research is in 12 steps or now smart recovery and those kinds of things to get you in a recovery focused environment. It's a lot of times creating new social circles. You have to create new friends because a lot of times your friends or family were the ones who are engaging in that behavior with you. So it's really removing yourself a lot of times from those situations and relearning how to live life. But it's very relational. You have to do it with other people. It's not something you can generally do on your own, which is why we're here to support all of our residents and also trying to get them connected with a recovery focused environment once they leave our care.
Yeah, great point. I want to get this comment in from Michelle. Michelle asks, it says, hi, hey, Michelle. What is the difference between a dual diagnosis treatment center versus treating co-occurring disorders?
They're very similar, actually, and a lot of times words are used interchangeably. So dual diagnosis is kind of the previous term for it, and now it's more co-occurring, focusing on dual diagnosis. Sorry, let me back up a second. Could be like primary substance with an underlying mood condition or vice versa, where co-occurring can be, I can't really pick out which one might be the primary out of them, and we're going to treat them both the exact same. So all of the mood groups are just as important as all of the substance groups.
Gotcha. Cool. Thanks so much. Thanks, Michelle, for your great question. And also just want to reiterate that if you guys have any questions or anything that pops up at any time, please feel free to hop in here with questions, or of course, just say hi. We always love it when people say hi. Before we keep going, I just want to pause too and get another definition from you. What exactly are mood disorders? Because we've talked about them a few times insofar as this whole just panorama of different things that people might be struggling with in treatment. What are mood disorders?
So that can be anything from trauma or depression, anxiety, trauma-related conditions, so PTSD or things along those lines, or personality disorders as well. So we see a lot of women who struggle with borderline personality disorders or the traits of that, which all stem from that trauma underneath. So since we're predominantly women, or we are a women treatment center, that we see a lot of women who have struggled with trauma, and then those relationships are a struggle then as they grow up.
Yeah, wonderful. Okay, thanks so much. So how does someone know that they need treatment? Because they might be struggling with something, or a family member or loved one might be watching their family member or loved one struggle. When do you know when a line is crossed, like, okay, I can't do this on my own. I really need treatment, or this person needs treatment?
Yeah, it can show up in a variety of different ways. I think lately, a lot of times our society has gotten very normalized to drinking and social drinking. So it can be a hard line to see where is it just social drinking and when is it becoming a problem. And I think looking at any substance use is focusing on when does that line is more are you using it to avoid a lot of life situations, and not that one glass of wine is now turning into a bottle of wine as you're going home? Are you okay drinking alone versus with friends? Are you using Do you have to use it when you get up in the morning because you're feeling some withdrawal symptoms? Are you getting like shakes or vomiting and those kinds of things? And it's different for every person, and we can build up a tolerance for whatever substance we're using. But I think alcohol is the hardest to find that balance of when is it healthy and when is it not. But definitely cocaine, heroin, those things that are a real struggle in our society right now, especially heroin, any use. Needs to, you need to seek treatment in some way. And then alcohol or even marijuana, now that it's legalized in some places in our country, is how often are you using it and what is the motive behind using it, can a lot of times be that you notice that line quicker.
Yeah, absolutely. Here, Becca's got a question just quickly. Hey, Becca, great to see you. Becca says, where does comorbid come in with dual diagnosis and or co-occurring?
Those are all very similar words for the same thing. So comorbid is similar to co-occurring in that they're all showing up at the same time.
Okay, gotcha, cool. It's funny. It's just a pet peeve. Like, I hate that word comorbid. It just feels so yucky.
I think it's the morbid piece of it that makes it sound worse.
I know. And like when you use it, it's like, oh, I sound so scientific or you sound so clinical or whatever. But I also just hate that word. So thanks, Becca, for your question. Great thing to clarify. And Shauna also says, hi, Kristen and Samantha, love and light from Ireland. Hey, Shauna, so good to have you here. Thanks for saying hello. I wonder if you have some advice for parents or a spouse, girlfriend, boyfriend, friend who has a loved one that they really care about, that they're seeing their behavior change, and it seems to them like this is really, really starting to be a problem. Obviously, that person could be extremely resistant to someone approaching them and saying, hey, you need to get treatment for this addiction, or obviously eating disorders fall into this category as well. What advice would you give someone in how to approach a conversation with a loved one who you think might be struggling with addiction?
I think it's definitely starting with like a loving perspective and understanding where they're coming from. Like you alluded to, a lot of people who are struggling or in the midst of it don't want to admit that they're struggling with something or that they need help. So I think it's more providing that comfort and compassion and trying to help them see where things might be falling apart or where your concerns come from, and doing it more from a concern point of view, not a scolding or a judgmental point of view. And then I think as it continues, and if they are not open to treatment at that time, then it's working to figure out what boundaries need to be in place so then you're protecting yourself as well.
Yeah, that's a great point. Can we talk a little bit about the concept of rock bottom? Does someone need to hit their rock bottom in order to get treatment? Is rock bottom like too late? What is the whole concept of when someone should get treatment? Do they have to like be all the way at the end of themselves? And because I just feel like it can be a tricky concept, because if you feel like you're not serious enough to get care, then you're just prolonging something, or then it might be too late. Like, what's the whole deal with rock bottom?
I think rock bottom differs from person to person. It doesn't necessarily mean I've lost all my life savings, I have no relationship with my families anymore. Rock bottom could be maybe just almost getting a DUI or having to pass a drug test or things like that might scare someone enough to realize, hey, what I'm doing is not what is aligned with my values or what I want to continue doing in my life. So it's, no, you don't have to hit rock bottom or whatever that might mean for someone to seek treatment. It's just their will to want to seek treatment.
Yeah, and to deserve treatment, because I think I feel like it's probably pretty similar. And I've had some friends who've gone through this and expressed the same thing, especially with trauma as well, that they see people with these very extreme stories, right? And we often compare ourselves and say, well, I'm not homeless living on the street, so I don't deserve treatment for a drug addiction. Or, I'm not falling over drunk in the middle of the road, or, maybe I don't have a DUI, so I'm not addicted to alcohol. But no, we don't compare. It's just like for someone with an eating disorder, you say, well, I don't look like that Hollywood celebrity or whatever that's plastered all over the cover of the magazine. I don't have an eating disorder. I don't deserve treatment. No. Everyone is different, right?
Yes, absolutely. And it can just be like, you have to know that you want it. And it doesn't matter, like you said, if how functional you're being in life, whether you're still getting up and going to work every day, but you're struggling with this on the side, doesn't mean that you don't deserve it or you're not bad enough to seek treatment. That's why there's so many different levels of care to help support someone through that process.
Yeah, absolutely. So is it possible to fully recover? We just talked about this yesterday with our guest, that some people think that they're going to struggle with an eating disorder forever, but we know that's not true. But people do fully recover as well from addiction. Do they not?
Yes, they do. I think it's something you're always going to be living in recovery. It may not be something you ever can learn what a normal balance is of whatever your substance of choice was. But it doesn't have to be as difficult as it may be when you first start treatment. It will definitely get easier as you go through the process and just learning that new way of life without that substance.
Yeah. It gets easier. I think that's such an important thing to emphasize. It gets easier, I promise. So Becca's got a question here, Sam. She says, could you talk about how at TK you decide what takes priority when someone comes to you with an addiction and an eating disorder?
I think that's what makes us great and different, is that we don't have to pick one priority over the other. Our group schedule is set up in a way that they can have both types of groups and explore both things with their therapists while they're here. So they'll have a primary and family therapist, and they'll also have a dietitian. And we have substance use specialists as well. Our CADC team does a really good job to meet with those residents who might need both. And we have eating disorder specialists. So just because they have an addiction or an eating disorder, here we don't have to pick one or the other. You can work on all of it at the same time.
Gotcha, really great. Thanks for explaining that a little bit more. And thanks, Becca, for asking the question. Hold on, I had that comment. So I do want to ask you one more support-related question for people who are supporting someone. What is the best approach for support? Is it unconditional love? Is it tough love? Where do boundaries come into play with this? As let's say someone's coming back from treatment, what is the best way to support that person?
I don't think there's one specific answer for your question. I think it all varies on where that person is in their recovery journey. But like your last part of that question is the most important, that boundaries will be what helps that person, whether it's tough love or unconditional love. The boundaries help find that fine balance between the two. And so it's working. I encourage all of our residents to have family therapy at least once before they go home. So that way you can go over your relapse prevention plan, whether that's eating disorder based or substance use based, or both. That you can go over what does support look like for you and explore with your therapist and with your family what that support looks like. Do you need them to remove things before you come back into the house? If you're struggling, what does a conversation look like to support you? What are things that are not helpful to support you when you're struggling, so that all of those things can be out on the table and you're not trying to figure that out without the 24-hour support you have here.
Yeah, it's so good. And I also want to give permission and validate too what you said, that obviously family therapy is incredibly important, and it's okay for parents and or siblings, people around, to get therapy as well on their own.
Absolutely.
Because you need support as well, especially if you're someone who's caring for that individual. That it's okay and good for you to get therapy as well if you need it.
Absolutely. So, just to add one more thing, family therapy doesn't necessarily need to be immediate family either. Your family can consist of your friends or other people who you consider in your support system. So family is like a loose term here for whoever's going to be that support once you go home.
Yeah, absolutely. Really great point. And Megan here said, it gets easier is so helpful in breaking out of that black and white thinking. And that's so true. Do people who struggle with addiction and are in recovery deal with that same kind of black and white thinking as the eating disorder?
Absolutely. And kind of that I made a slip, so I'm just going to screw it all and go back to using. And it's that slip doesn't need to turn into a whole slide. And that as difficult as today might be, the more you work in your recovery program, the easier it does get.
Yeah. And that kind of leads to that point I mentioned at the beginning. It's that, oh, my therapist gave me this great picture. And I want to see if this still makes sense. You can let me know. She said, like, from a brain perspective, our brain gets wired like a record gets going on one record groove. And these neural pathways are created. You mentioned the pleasure principle, the thing that helps soothe us, regulate our emotions, make us feel good the fastest. And she said, but you can get the record to skip and play on a different song. Like, you can get the record going on a different groove. You can create new neural pathways. And that's the whole, it gets easier part, but it's just this new, you need to get the new song, right?
Yeah.
That's still the right way of thinking about it.
Yeah, absolutely. I use an analogy too. Everyone has seen, like in the store, they conveniently put all of the candy right at like child level. So the kids see in the checkout aisle exactly what they want to eat. And so your eating, like your urges for an eating disorder or for an addiction run kind of like a toddler. So the more that you tell them no, they're going to scream and cry. But giving in, that toddler then next time knows exactly where to start screaming to get in faster. And our urges kind of run the same way, that like when we give in, they know how strong to start. So then you're giving in faster. So it's once you kind of get through that point of it feels like I can't bear it anymore, they will eventually, the tantrum will subside and we'll start to relax a little bit. Mm-hmm.
I love that. That's really, really good. I love that one. Thank you. So last question here. If someone is listening to this right now and they are in a really tough spot in their eating disorder or struggling with an addiction, how can you, I mean, you said so many encouraging things already, but like one last final word, how would you encourage them?
I would just say don't give up, that just because you've tried it, you may have tried it 100 different ways before. This might be the 101st way that clicks for you. And it finally makes so much sense. That you're never too far down the path to recovery. You're never too sick to make it work. That it's always worth fighting for when you want it.
Yeah, absolutely. I'm like getting emotional. Sam, thank you so much. I really, really appreciate your time and attention to this, as well as obviously your great work with these women every single day. Thank you for your service, for what you do. And it was really a joy to have you on. Thank you.
Thank you. Thank you for having me.
You're so welcome. So, guys, thanks so much for being a part of the show today. I hope that you were able to be inspired and encouraged by something that Sam said. And just, yeah, never, 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 never give up. Doesn't matter how many times you failed. You can always, always stand back up and try again. Don't give up. It does get better. We promise. So anyway, just want to leave you with that. I hope wherever you are in the world that you have a wonderful day. And we got Ireland there. Usually we've got South Africa, obviously all across the United States. But thank you guys so much for tuning in. And we'll be back next Wednesday as well for another episode of Weekly Hope. So stay tuned to our social media to find out time and guests. But we're going to do 12 p.m. Eastern. I'm 95% sure. So we'll keep you posted. Thank you for joining us, and we wish you a beautiful, blessed day wherever you are. Ciao.